You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures, according to my first guest. With us, we have Dr. Richard Hixson. Dr. Hixson, welcome to the program.
Thank you very much. It's a pleasure to be here.
Good. Now, before we get into today's topic, we're talking about dental implants today. Who's a candidate? For people that don't know you, who's your typical patient, and what are the different procedures that you do?
Well, Randy, I don't think we have a typical patient at Lakewood Dental Care. We have patients from 2 years old to, I think our oldest now is 102 years old. We have 4 generations in the same family. We have just one person, maybe just a single person in a home family. We have people that have implants. We have people that come for just fillings. We have people that only come for clings every now and then.
So you've been there 33 years.
Yes. We have.
So everybody knows you in town?
Pretty much, I think. It's a great community to be in. We do fillings, we do root canals, we do crowns and bridges, we do sleep appliances, we do a host of dental services.
So just about everything.
Pretty much.
Right there. Also, you're a big IV sedation guy for people that are afraid of the dentist.
That has really been a boon to people. One of the biggest surprises I had was how many people love to come and get so much done at one appointment. When I first went and got training in sedation, I did it for people who were fearful, had phobia about the dentist for whatever reason. Some had bad experiences when they were younger or something happened. But the big surprise to me are the people, business people perhaps, that want to get everything done at once. Long appointments, get lots done. So
You're one of the few general dentists that does IV sedation where you are?
Yes, I am. I was the first in the state that had all the credentialing to do the conscious oral sedation, and now we've moved in. We're doing that along with IV sedation.
Now, for the dental implant crowd, like the people that you say they walk in without teeth on a day, and then they walk out with teeth that are fixed in their mouth, a full set of teeth. Is that true?
That's possible to do.
So you've done that?
Yes. Yes. It's a great service. I think I have a model here. This is what we call an all-on-4.
Okay.
You come
What does that
in.
mean, all-on-4?
Well, I mean, there are 4 implants holding up a fixed, what I call a fixed detachable prosthesis, where you come in and you walk out with teeth.
So it's a full set of teeth?
Full set of teeth.
So when it's all done and they're healed up, what can they eat?
Randy, you can eat pretty much what you want to eat. Corn on the cob, ribs off the bone, steak, anything that you can go out in the garden that most of us have and eat raw.
Carrots?
You can eat carrots. You can eat corn on the cob. You can eat broccoli. You can eat tomatoes with the skins. Bite right through it. It's not going to slip off your hamburger and fall on the front of your tie.
Do they tell you these stories? They say, Dr. Hixson, I just ate the first whatever.
The first implant-supported denture I ever did many years ago was a sister of a patient of mine, had been a patient a long time. And she also was a member of the church where I was the organist at that point in time. I used to play the organ an awful lot and was playing every Sunday for a Methodist church. And so I really wanted to do it well. I was, this really had to be good, because not only was my patient's sister need to be impressed, but the whole church was going to hear about this. So it had to be good. And I'd worked, and I wanted everything to be really good, and we worked, and we got this lower denture in, and I was really sort of patting myself on the back. I'd really done something swell. And she left, and okay, this is great. And I was going to call my mother and tell her about it. Her boy had done good. And I looked up about 30 minutes later, and she was coming back up the sidewalk. And I thought, oh my God, what have I done? She's coming back, something's going wrong. And so I met her at the door to open the door, and just all of a sudden, she threw her arms around me. There were tears coming down her cheeks. She just wanted to thank me. She said it was the first time in 25 years she had been able to eat a hamburger, that she went immediately and bought a hamburger, bit through the lettuce and the tomato, and it didn't slide down her chin and go on her dress. And she was so pleased. She had to come back and hug my neck and thank me. Made me feel so good. And we were both so pleased. And that really encouraged me to study more and learn how to do more and more to help people with implants. It was a great day.
So that's a good story. Are there a lot of denture wearers? People that are wearing, false teeth where you are?
In Arkansas?
Yeah.
Hundreds of thousands of people in Arkansas wear dentures.
Okay.
We're probably the denture capital of the world.
Is that right?
People come into my office every week. I'm not joking. Every week and say, my mother has dentures, my grandmother, my brother and sister, I want to have dentures. Am I ready for my dentures?
Really?
They somehow don't get that in 2014, you do not have to have a denture anymore. The whole world's changed. We don't have to have dentures. If the disease process has progressed to the point to where teeth have to be lost, there's a great way to replace teeth without going to a denture. We have titanium root form implants that can be put in to put teeth on. I have a couple of implants.
You have a nice smile.
You cannot tell which one have my roots and which one have implants. And I certainly eat corn on the cob. I eat raw carrots. I eat anything I want to eat. And I did it, and it didn't hurt.
Okay, so if there's hundreds of thousands of people in Arkansas with an upper or lower denture, why aren't they all doing it? Why aren't they all coming in and saying, for one of these snap-on, snap-out denture or a fixed set of teeth? What's your take?
Well, Randy, this is my opinion.
Okay.
But I think because a lot of people don't know what's available, because believe it or not, many people get a set of teeth, false teeth, and if they don't break them, they don't ever even come back for a reline. That's the set of teeth they use for a lifetime, because the human body is so very, very adaptable. You have bone loss in your jaws, but you see people, if you really look, they're holding those teeth in with their lips and their cheek muscle. They don't smile a lot. People may think they're grumpy, they're whatever, but the truth is they're helping keep those teeth in.
Interesting.
With their cheeks and their lips.
You could spot it when you're out and about.
Sure. If you've been looking at teeth for 30 whatever years, a minute.
Okay.
But we're really adaptable. They don't know. I mean, who's going to go around and say, "Oh, I think you're holding your teeth in with your cheeks. You can get some implants and hold them in." They think that it's probably going to hurt.
It does seem like it's going to hurt, by the way.
But the jawbone doesn't have any nerves in it. It really doesn't hurt. I'm living proof. I didn't hurt. I had them. They think it's going to cost a king's ransom to do it, and there are lots of ways to get around that. There are ways to finance whatever, but it's certainly not the most expensive dental procedure in the world. And they think they're too old. But,
how old can you be to do it?
Till about 2 hours before you go meet your maker. As long as you have good health at all.
I mean, even 90-year-olds
certainly,
can do it?
If you're in good health. If you're in reasonably good health, and you have any kind of bone at all, then you're a candidate.
Have 90-year-olds done this
Certainly,
before?
yes.
And they're not more likely to fall out?
No, if you are in good health and you got good bone, you're still making bone. Yes, you can put it in there.
Is that
It's
right?
great. It's a wonderful, it's the biggest deal changer since I became a dentist. It's great.
Is it the happiest group of patients? The false teeth people that come in and you could give them something to...
Yes, it truly is. The people that say that they're happy with their false teeth, I think, are the ones that when they got false teeth, they had horrible... They just don't wake up one day and decide they want false teeth. I mean, you used to wake up one day and decide you wanted your leg amputated. Something was horribly wrong before they ever had their teeth out. They had broken teeth, they had bleeding gums, they had pain, they had really bad breath, they were suffering with their teeth. They finally got that eliminated, so they eliminated a great source of pain and suffering in their body, and then probably they were much like myself. The dentist I went to when I was younger in rural Arkansas had been a dentist in the World War, had seen some horrible things in North Africa, was not, shall we say, didn't have nearly the advantages that we have now in dental surgery. Our anesthetics are much better. Our equipment's much better. It's just a whole new ball game. You know, back then they had 2 propellers on an airplane. Now we can go to the moon. It's a whole different deal, Randy.
Okay.
They had, it was not nice when you went to the dentist in the 50s and the 60s.
So now it's easy.
Well, yes.
It doesn't have to hurt anymore.
No. And they don't know it. It was bad when they went. They don't want to do it again. They say dentist and they cringe.
What if somebody's watching this? Because we said no more dentures, right? You know, that you can get them hooked on to dental implants in their mouth. And you say it doesn't hurt. It's virtually painless. You didn't say that, but...
Well, we'll call it a snap-on denture. It's still a prosthesis.
But they could get a fixed set of 4
yes,
teeth with just 4 implants.
Where it doesn't move anymore. It doesn't
but
slide
what if
around.
somebody is watching this and says, my denture's fine. I'm fine. Is there such thing as a happy denture wearer?
Well, they've adapted. They may not know they're not happy till they have some teeth that don't move. You know, they really may not, you know, and read about it and think and think, what do you not eat? Are you eating really soft foods? How are you digesting them? Are all the carbohydrates you're eating all mushed up, affecting your blood sugar and your diabetes? Go and see your loved ones or your friends at the nursing home and see what kind of diet they're eating.
I mean, on that consult, do they tell you like some of the problems associated with wearing a denture? I mean, you must hear all these stories.
Oh, you hear all of them. I think one of the best things I did for my mother was that she had a long bridge from here to here, and I knew it was going to fail. Had to fail. It was way too long. Fixed bridge, glued in. And I think she did to get me to shut up finally. But I kept, Mama, we're going to do something that's going to fail. You know, one of these days it's going to fail. So finally, we got a couple of implants put in, broke it up.
When you say fail, me, it's just going to crack and fall
out. Something's going, either the front of it's going to break, and it's going to be hanging loose, and it's not going to be good. And, you know, as she got older, things did happen, and, you know, her health deteriorated. But right up to when she went to meet her maker, if you put a steak in front of that woman, she could eat a steak. She could eat raw carrots. We fixed her dentition to where she did not starve to death. No, she might not have remembered what she ate 5 minutes beforehand, but she could eat it. And I was really, really pleased, because you go, you know, there's a nursing home 2 buildings down from my building, and most of those people are on soft diets. I got so many people that come, what can you do? Mama can't eat. Well, if you give Mama some teeth that are fixed, she can eat. I cannot tell you how many times I've gone to a nursing home and made somebody a new upper or lower or both dentures because they lost their dentures at the nursing home. If you fix somebody some teeth that won't come out where they can chew, their life's going to be better. You can digest your food better. As you were telling me before, Randy, you don't have teeth in your stomach.
Right.
You don't.
Yeah, I'm known for eating fast, and somebody once told me, said, Randy, you don't have teeth in your stomach. You know, you got to start chewing. So they can't really chew. I mean, denture wearers think they're chewing their food, but they're just kind of rubbing it together.
It's like a milling machine.
Okay.
You can't, because that lower is going to move.
So let's say within an hour of your practice, there's tens of thousands of denture wearers. You couldn't even handle the demand if they all came in.
No, the whole town would be overrun with people.
And let me get this straight. Also, insurance does not cover this. Medicare, Medicaid does not cover this for the most part throughout the U.S.
Generally, Medicaid and Medicare does not cover this. Some private insurance companies, if you're lucky enough to have it, will pay their yearly benefit, whatever that would be, for it. But there are ways to finance it. We'll work with you to try to work this out and get that done. But what you're looking at is your lifestyle change. Do you want to chew? Do you want to smile? Do you want to skydive? Do you want your teeth to come out when you're talking? So many people, every week somebody comes to me, Randy, and says, you know, I was at the restaurant eating with, and they'll tell me who, whether I know them or not, and I had to get up and excuse myself to powder my nose because something got under my denture because it moved. And it happens every week. You want to be able to smile. You want to be able to eat comfortably without something getting under your denture. Last time I read an article, over $50 million worth of denture adhesive is sold in the United States alone every year.
Is that right?
And that's that gooey stuff that people stick their dentures
And nobody
together.
likes that, obviously.
No, people come in, I hate that. It's gooey, it's hard to get out. I don't like swallowing it. And
But with
they've
two
made it
dental
out.
implants, you say you put 2 dental implants right here. You give them a full arch of teeth, like a snap-on denture.
Yeah.
They still need a little adhesive with that?
Most people don't. It'll move just a little bit, but it's not going to come out.
Okay. So what,
It's like 1,000 times better than just that sitting on your flat bone.
let me ask you this, because you said, okay, so if the denture wearers in your town came in, because you said you want them to come in and get evaluated to see if they're candidates, how soon from that consult do they find out whether they can do it or not? I mean, you tell them on day one?
Most times.
With
Most times.
certainty you know whether they could do it?
Once you see, most times, yes.
Okay. Okay.
Or
So-
you could tell them, and if the answer is not as good as you'd want, you can get some bone grafting done, nab some bone, and then they can do it.
What if somebody's been in dentures 30 years? Isn't it true, I mean, that their bone goes away and they're not candidates anymore for dental implants?
Well, that statement's partially true, Randy. Their bone does go away, but it does not mean they're not candidates.
Okay, so there are people, if you've been in dentures 30, 40 years, you could still do this.
Yes, sir. Yes, absolutely. You can. And it will change your life.
You know, I told you, my mother was told by her medical doctor at 73 that she was too old for dental implants. They would fall out.
Well, that was
It's
a
just
false
not-
statement.
Just not true.
No, absolutely not.
Okay.
Done it. I mean, it's false.
Now, the way you do it, and so the way I understand it, the way it's normally done is you go to maybe 3 places. You go to the imaging center, you go to the surgeon, then you go to the general dentist. You do everything, right?
It can be done that way, but it doesn't have to be done that way. It can all be done in one place.
So the way you do it is where you do the surgery and you put the teeth on top.
Many
that right?
times.
Is that an advantage? I mean, obviously a convenient to the patients.
Most people, I mean, no one, you can't make sweeping statements. Most people prefer to have it all done in one place with the same person.
And is this true too? Because you told me this on the phone, where people, they go in and with IV sedation, they kind of go to sleep, right? They wake up, it's all done. And they go, that's it?
Yes, sir.
Have people said that?
Yes. And, when you have sedation, you have little, if any, memory. That's what people love about the sedation part of our practice. And that's not all we do. Some people have a misconception that sedation's all we do. We do dentistry on everybody. You can come in and get a tooth filled or whatever. You do not have to be sedated. But there's a segment of the population that wants to be sedated. And that's great and wonderful. That's why we do it. And then, there are some surgical procedures that you probably should be sedated for. It's just better for everybody. But, when you are sedated, you have very little, if any, memory. And a lot of people say that's the greatest way to have dentistry. I had dentistry done. I love having dentistry done sedated. That's great. That's why we have it.
So when a denture wearer goes to you on a consult, and we're a bit short on time here, what do they want to know? Like, what's the questions that come up every time?
They generally want to know, is this the worst case you've ever seen? Which, no, it's generally not. I've seen worse this week. They want to know, how bad is it going to hurt? Is this going to be awful? They want to know how much downtime, how much work am I have to take off? They want to know how much is it going to cost? Am I going to have to rob the liquor store to pay for it? They want to know, when am I going to have teeth? Am I going to have to leave here with no teeth?
Does that happen? Are they ever left without teeth?
No. Not unless they just want to be without teeth. About 1 in 1,000 say, "No, I don't want any teeth. I'll just let this heal." And we really quiz them about that when they say that.
Now, we are just about out of time. You brought some models. What do you want to show me?
Well, I brought some models to show you what we can do. On the lower arch, we have to have 2 implants.
So there's 2 implants right there.
And it snaps on the attachments. You have to have 2 so it doesn't pivot, and it snaps right on.
Okay.
You'll still have just a little movement, and then we could add a third one, like a 3-legged milking stool, that's more stable, or we can have 4, like a dining chair, where you can't fall over at all.
So 2 is good, but the next level up is to add 4 implants for another snap in, snap out.
If you have 4, it's like having a dining chair. You really can't pivot at all. It's very, very stable. Got people who say that sometimes they have trouble getting them out.
Is
They
that
are
right?
so stable. In fact, before this winter, an old professor of mine sent his daughter-in-law to get some teeth done, and I visited with her, and she elected to have 4 implants done on the lower. And I worked
like
really
a snap-in,
a snap-in, but we put in 4 instead of 2, so she would have a really, really secure lower, because she's about my age and should live a long time. And they came back to, for us to look at and be sure everything was fine. And she told me one night she really couldn't get them out. And she got her husband, who's a really big guy, 6 or something, big guy. He said he was in her mouth trying to get them out, and finally decided they were going to get a pry bar to get them out. But she can eat now, and she's so pleased. But they're really tight. They're almost as good as the teeth she grew before they came out. It's really great.
So you adjust them,
yeah,
so they can pull them out. Because some people have arthritis in their hands.
Yes, you have to be careful. If you have arthritis or whatever, you can't make them as tight. And the little inserts, you have different.
See that? Okay,
different inserts.
So so underneath there's these 2.
You have options of the amount of grip you put in the inserts.
And you can use their own denture if you wanted to.
Sometimes it depends on the shape their denture is in and how thick it is and how well it fits. Though denture, it's been there 30 years and doesn't fit, we'd certainly prefer not to. We'd like to get a denture that fits the anatomy well before we put implants in it. And if it's been 30 years, it's not going to fit too well.
So a lot of people come in, and we've talked on the phone, but a lot of people you say come in and they just want to be able to eat and chew, right? Laugh out loud, no more loose-fitting denture. But the side effect, and I'm using those terms, is they end up with a beautiful smile. And you see a personality change, and it's a boost in their self-esteem. Elaborate on that.
Well, the smile is the first thing that people see. And if you're not holding your denture in with your upper lip, you can smile again. You can interact with people so much better, and people feel better and more confident about themselves because they don't think when they sneeze. Well, another memory I have, I was 5 or 6 years old. We had a church children's choir, and the lady helping it sneezed, and her upper denture blew across the fellowship hall at the Methodist Church in Paris, Arkansas.
Wow.
And about 50 little kids just sort of, it seemed like 5 minutes, I don't know how, just were stark quiet while she scurried across the fellowship hall to scoop up her teeth and put them back in her mouth.
That's embarrassing.
And I remember that's been 54 or 5 years ago, and I remember that like it was yesterday. So that's not going to happen if your teeth are fixed in your mouth.
So there are denture wearers walking around worried about like laughing.
It happens when you sneeze. Your soft palate goes up. You've got to hold that upper denture in.
Now you say there's the upper is nice. Why?
Because the palate is cut out. Most of your taste goes up through your soft palate, your taste buds. You can taste things again. The palate's cut out. You have all that mess in your mouth. Okay. All the upper flange, all this is covered with an upper denture. This is cut out. These are in there, and it's as near to having a full set of teeth as you're ever going to get.
But the upper has suction, right?
Hopefully. It did to begin with.
Okay.
It may not anymore after you've worn them for 30 years. You may have to glue them in.
So a complimentary consultation?
Yes. We'll look and see, and we'll tell you what we know. Would love to help anybody, and you can go home and think about it. Look it up on the internet, read about it.
Do you want them to bring, if they are married, do they bring their spouse with them, or?
Most people really do like to discuss it with their significant other.
Okay.
And then there are some folks like my wife. By God, she wants some teeth. She's gonna get some teeth.
Okay, so you have a dental implant. You claim it doesn't hurt very much.
Got 2. I'm getting ready to get a 3rd one.
So, I mean, somebody, because 75 is young today.
Yes.
So when they come in, pain is really not something they complain about?
No.
Okay.
Well, pain is not the issue. The issue is most people, well, I may be too old. It's a lifestyle issue in the way you want to live. One of the ways I could get my mother to do what I really thought she needed to do was, I promise you, Mom, if you don't spend the money you made, Suzanne and I are going to spend it before we put you in the ground. Then she would do it. Well, I ought to save it for my children. You don't know how long you're going to live, and you sure are not going to be able to chew in the nursing home without
When it's all
teeth.
done, when it's all done, is this one of those things where they say, I should have done this, doctor, years ago?
No, what they'll say to me is, why did you not make me do this 10 years ago? Why didn't you make me do it? Well, Miss Smith, I couldn't make you do it. I've been talking to you about it for years. It had to be your choice. I can't make you do anything.
So they were your patient, maybe a denture patient of yours would come in for rewinds.
Or somebody that wore partial denture or
why didn't you
whatever.
tell me?
Why didn't you make me do this?
Why didn't you make them?
Well, I can't tie them up.
Okay, so now look, patients that know you that are wearing dentures are going to be watching this, okay? Because you're a non-pressure guy.
No, I do not. I truly do not like
what
to
do
be
you
pressured.
Now that they're not in front of you,
I don't
what do you
like
want
to be
them to
pressured.
know? Tell them right now. Well, I mean, what do they, so they don't end up like your patient that said, "Doctor, why don't you tell me?" Come in.
You will eat and chew and smile and be so much more comfortable if you have some sort of fixed false teeth in your mouth.
And you'll be much happier.
You'll be much happier. And as our lives get longer and longer, and unfortunately we will deteriorate, you need to do it before something bad happens, because if you have to have something like IV bisphosphonates to make your bones harder or whatever, then it gets a whole lot trickier to do anything about it.
But people that come to you, they have a little bit of osteoporosis, they can still qualify.
And you know, we really don't like to do it if you've had IV bisphosphonate treatment.
Okay.
You know, that's when you start having bad things happen in your bone.
Now we are out of time. Okay, but people can walk in without teeth, walk out with teeth in your office.
That's right.
Okay, good. Final message. Somebody watches, and we are out of time. What do you say to the denture wearer?
You need to come in and be evaluated and have no more dentures. You need to have them attached to implants.
Okay, good. I want to thank you for coming on the show. Very good. Very excellent. And thanks for coming on the program. And if they want to know more, they could go to your website.
Certainly.
Make an appointment.
Certainly.
Learn a little bit more.
Yes.
You've been watching The Wellness Hour. I'm Randy Alvarez. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.